Professor Henning, and we're here to shoot some of the skull to help you in your identification of the skull and the bone markings of the skull. Starting with the superior view of the skull, we have the frontal bone and the two parietal bones and the occipital bone. And the sutures separating those bones are the coronal suture following the coronal plane, the sagittal suture, and the lambdoid suture. The other suture on the side of the skull is the squamous suture. Looking at the skull from the anterior view, we have the frontal bone, and on the frontal bone we have the supraorbital ridges, or the brow ridges, your eyebrow ridges, that are more predominant in males. We have the two nasal bones, and then next to the nasal bone is the maxilla. The lower jaw, the upper jaw is the maxilla, and that's part of the maxilla. On the other side, also maxilla. And then moving into the eye orbit, we have the real thin lacrimal bone that you can always tell from the lacrimal duct where your tears drain. The superior roof of the eye orbit is the frontal bone. Behind the lacrimal bone is the ethmoid bone. And then in the posterior portion of the eye orbit is the sphenoid bone. The sphenoid bone in the back. And the lateral portion of the eye orbit is the zygomatic bone. Again, we have maxilla forming the maxilla forming the inferior floor of the eye orbit. In the very posterior part of the eye orbit, we have this big crevasse, which is the superior orbital fissure. We also have a foramen, the optic foramen, that we'll see better from the inside of the skull. Looking inside the nose, we have a bony nasal septum made of the vomer bone in the inferior portion of the nasal cavity, and then the perpendicular plate of the ethmoid forming the superior part of the nasal septum. And we also have some scroll-shaped bones, the inferior nasal concha and the middle nasal concha. Looking at the inferior portion of the maxilla, we have the palatine process of the maxilla, this entire region, the palatine process, and then posterior to that we have the palatine bones, the two-paired palatine bones. Looking at the inferior side of the skull again, we have the occipital bone in the back, and in the occipital bone we have the very large foramen magnum where your spinal cord exits the brain, and the occipital condyles, which articulate with the first cervical vertebra. We also have the large mastoid process and the styloid process. We also have the tergoid processes. Tergoid meaning winged, spelled with a P, a silent P, but tergoid processes, which are part of the sphenoid bone. Looking at the foramen, starting again with the foramen magnum, we have the jugular foramen next, and then we have the carotid foramen, or the carotid canal, the very small foramen spinosum next to the spine, and named for the spine, foramen spinosum, and then the foramen ovale, or rather oval opening, and then finally the foramen lacerum. Again, magnum, jugular foramen, carotid foramen, foramen spinosum, foramen ovale, and foramen lacerum. Looking at the skull from the lateral view, again we have the zygomatic bone, or the cheekbone, and it articulates with the zygomatic process, which is part of the temporal bone, and the zygomatic bone with the zygomatic process forms the zygomatic arch. We also have the sphenoid bone, again from the lateral view, the temporal bone, again we said this is the squamous suture, and the opening for your ear is the external auditory meatus, or external acoustic meatus. We can also see the styloid and mastoid process from this view as well. Looking at the inside of the cranium, we see again the two frontal bones, and between the two frontal bones is the ethmoid bone, and part of the ethmoid is the crista galli that sticks up, and then it rises out of the cribriform plate or horizontal plate. so cristogali and cribiform or horizontal plate. Then again, looking at this bone, which resembles a bat, we have the sphenoid bone, and we have the lesser wings and the greater wings of the sphenoid. Just or part of the sphenoid bone is this little depression called the sella turcica or Turk's saddle. That's where your pituitary gland sits. And then we have the optic foramen, where your optic nerves exit the eyeball. The foramen rotundum. It's hard to see, but the superior orbital fissure from this view. And also, earlier we talked about the foramen ovale, and the foramen spinosum can also be seen here. Wormian bones are variable bones, or sometimes called sutural bones, where the suture lines that we see, not every skull follows that exact pattern, and sometimes we have aberrant sutures that form additional small bones called Wormian bones. So they're variable, they can be found really any place in the skull, but they're just extra little bones, additional bones that different individuals may have. Moving to the mandible, the lower jaw, just looking at the mandible itself, we have the mandible, including the alveolar processes. Again, we saw alveolar processes in the maxilla. We also have them in the mandible. Once again, they're tooth sockets for the teeth to reside. The small foramen are the mental foramen. In the very middle, we have the mandibular symphysis. Your mandible starts out as two bones that fuses to form one mandible, and that fusion point in the middle is the mandibular symphysis. Looking from the lateral view, this is the body of the mandible and the ramus of the mandible. This is the mandibular condyle, which goes into the mandibular fossa in the temporal bone of the skull. Looking inside the mandible, we also see the mandibular foramen, two rather large opening where nerves exit the mandible, the mandibular foramen. The mandibular condyle, again, this knob-like process that we mentioned in the mandible, goes into the mandibular fossa. A fossa or fossa is a shallow depression, and that forms your TMJ or temporomandibular joint. Many people have a problem with that joint. Looking at a slightly different skull, we're trying to show the sinuses. And in the frontal bone, we have the frontal sinuses, again, hollow places within the bone. In the maxilla, we have also hollow places called the maxillary sinuses. You can see it's quite a hollow cavity. And then the third sinus is the sphenoid sinus. And you can see the sphenoid sinus, this opening, which is right below the sella turcica. Looking at a fetal skull, we have several fontanelles. Fontanelles are also known as soft spots where the skull hasn't completely ossified. And here we have the the sphenoid fontanelle, the mastoid fontanelle, close to the mastoid process, and then the anterior fontanelle you often see in a newborn. You can actually feel a pulse in that anterior fontanelle, and then the posterior fontanelle. So again, posterior fontanelle, anterior fontanelle, sphenoid fontanelle by the sphenoid bone, and mastoid fontanelle. One bone we start with, it's part of the axial skeleton, is the hyoid bone. This is a bone that doesn't articulate with any other bones, but this U-shaped bone is the hyoid bone. And again, it sits right above your thyroid cartilage or your Adam's apple, and is held in place by soft tissue.